You hear the word potassium, and what do you think of? Bananas, right? It's that super healthy, essential nutrient our bodies need. And you're not wrong. But what if I told you there's a flip side, a point where this vital nutrient can become, well, a hidden danger? That's what we're digging into today, the surprisingly silent problem of having too much potassium.
Okay, so let's get the basics down first. Potassium is, without a doubt, one of the good guys. It's a mineral that's kind of like your body's master electrician. It's in charge of making sure your nerves are firing right, your muscles are contracting smoothly, and probably most importantly, it keeps your heart beating with a nice, steady rhythm. You absolutely need it, no question.
And that leads us to the big question, doesn't it? If this stuff is so good for us, so essential, how on earth does it go from being a friend to a foe? Well, it all comes down to a really delicate balance. And when that balance gets tipped, that's when the trouble starts.
So let's go ahead and put a name to this problem. The official medical term is hyperkalemia. I know it sounds a little intimidating, but breaking down what it means is really the first step to getting a handle on the risk.
Hyperkalemia is actually pretty simple when you break it down. Hyper just means high or too much, and kalemia refers to potassium in the blood. So put it together and it's just too much potassium in your blood. And when that happens, it can seriously mess with that electrical system we were just talking about, creating major problems, especially for your heart.
And this slide just shows it perfectly. It's like night and day, right? Over on the left, when your potassium levels are just right, you get that happy, steady heartbeat, everything's running like clockwork. But look at the right. When there's too much potassium, it throws that whole system into chaos, and that can lead to some really scary, irregular heartbeats.
So you're probably wondering, how does this even happen? I mean, it's not like you get it from eating one too many bananas, right? The causes are actually pretty varied. So let's uncover the main reasons this overload can happen. Okay, so there are a few usual suspects here. Sure, a diet that's just off the charts high in potassium can be a factor. So can certain medications, things like some very common blood pressure meds. Other diseases like diabetes can play a role too. But, one of the biggest and most common causes, and the one we're really going to zoom in on, is kidney disease. Now, to really get why the kidneys are so important here, you have to appreciate what they do. Just picture them, these two amazing fist-sized organs that are basically your body's master filtration plant. They are working 24/7, cleaning your blood and keeping everything in balance. And here's how that system can break down. In step 1, healthy kidneys are brilliant. They know exactly how much potassium to keep and how much to get rid of. But in step 2, when those kidneys aren't working so well, they can't do that job effectively anymore. They can't get that extra potassium out. And that leads directly to step 3. The potassium starts building up and boom, you've got hyperkalemia. All right, we know what it is and we know why it happens. Now we need to talk about something incredibly important. How do you even know if you have it? What are the warning signs? And here is the kicker. This is what makes this condition so sneaky. A lot of the time, there are no signs. Many people walking around with dangerously high potassium levels feel totally fine. They have few or literally zero symptoms. And that's exactly what makes it so dangerous. Now, sometimes the body does send out some subtle clues, but they're things that are so easy to just brush off, A little muscle weakness, some weird numbness or tingling, feeling extra tired, maybe a little nauseous. It's so easy to just blame that stuff on a stressful week or a bad night's sleep, but they could be your body trying to tell you something. But then there are the signs that are absolutely not subtle, and we have to be really clear about these. If you, or anyone you know, starts experiencing nausea with vomiting, shortness of breath, a weird fluttering or irregular heartbeat, or chest pain, this is an emergency. This is not a wait-and-see situation. You need to get medical help right away. Okay, I know all of this sounds really serious, and it is. But the most important thing to take away from this is that hyperkalemia is manageable. There is absolutely a path forward to staying healthy and hopeful. So, because this can be such a silent problem, the number one takeaway here is that you have to be proactive. Regular checkups are absolutely essential, especially if you have any of those risk factors we talked about, like kidney disease. And if you have a treatment plan, following it to the letter is your absolute best defense. And I really want to end on this note, with this powerful message from the National Kidney Foundation. It says, the good news is that when it's found early and treated right, the outlook can be very bright. That says it all, doesn't it? Finding it early and managing it properly changes everything. So as we wrap this up, remember that this information isn't just to scare you. It's to empower you. It's a tool for your own health. And the best way to use that tool is by being proactive. So that really only leaves one question. Are you scheduled for your next checkup?